right, so I've enabled recording. Dr. Dr. Eric, you can begin the discussion. Thank you. When I have the slides, I will share along. I don't have them yet. When I have it, I'll share along. But please go ahead and start. Can Eric hear me?
Yeah, boss, I'm trying to send it.
Oh, no, that's fine. You start the discussion whilst you try to send it. Maybe next week we will send this ahead of time for those who cannot share themselves. Jane, I would ask in the month of September, Frank, try and let Jane also do a presentation. Let's see what the lab can also tell us. We can know that. So reorganize the presentation in September and put slots for the lab as well. And then maybe one slot for the nurse as well.
Good morning once again.
Thank you. Go ahead.
So, presenting on enteric fever. And at the end of the discussion, you should be able to know what enteric fever is, our cognitive organism, and pathophysiology, our clinical, our possible likely differentials. Our management complications and then how can you prevent it. Okay. Start by the definition of we start by defining enteric fever. So we say enteric fever is a severe bacterial illness which occurs where sanitary conditions are very poor, permitting to contamination of food or water with feces. So we can see that the main route for this disease is through fecal-oral. Okay, and it's mostly caused by organism called Salmonella typhi. And then under this organism, we have it's caused by Salmonella typhi and then paratyphi. And then under the paratyphi, we have the subtypes A, B, C, D, E, F. But those that causes the enteric fever are Salmonella paratyphi A, B, and then C. So these are the species that causes enteric fever. All right. So how do they cause this illness? Before someone can contract enteric fever, there must be a root called the fecal-oral route, as I said. So the organism ova must present in the feces of what? An infected person, which maybe the individual or the host has shared it somewhere into wakoja and baby. And then there must be a vector that will carry this the ova from the feces and then maybe settle on your food or any other part for you to also contaminate yourself with. And then at the end, it gets entry into your system. In short, no, obi jan na go baby no, because the person was infected no, the presence of organism ni over no, or feces ni, and a fly because see so. Because you were not able to cover your food well, no, fly need the sea or and so, and then you also took it into your system. So that's where the entry begins. So after the organism enter your system, it first goes straight into your intestines. As we know, in the body, we have three body defense mechanisms. The first or the primary defense mechanism, the second defense mechanism, and then the third defense mechanism. We get to know it one by one. So as you take in your food, you say you try to masticate and also you chew it. When you chew it, that's where some of the digestion of other food substance will begin. After that, it will pass through your intestines. When it get there, there are some acids that will react on the food to help facilitate in what digestion. Something like trypsin, renin, and then other stuffs. So all these acid or enzymes will react on the food to break down the food substances. But the senior say, you see, when you accidentally swallow a fly, you say, oh, na bibi raw minimum say with you in your nose, no, we have something called the hair in your nose. It me trap the chrono. Now say him, then it will come out. When it enter into your throat, utimi say utimi then it will come out. So that those mucosa areas, no, and on the Nyaminko iron said those are our first body defense mechanism. Into accidentally aboni rahon. When to me many. So they will come out. So they will protect your body in the first place. And then say abuano accidentally say otimi ura system. Nasa yeah, that's where the body will see say when you're foreign body. So if say one foreign body in the system now, the body will try to release what we call the white blood cells or the macrophages to come and fight against those organisms. And then they do so through various means. Some will create at a temperature whereby the organism cannot survive. So that the ultimate survival, they are then end up dying. Others too will create a pH at which the organism cannot what, survive. So I'm trying to divert. Those are the second body defense mechanism that we know. So your white blood cell or your macrophages will try to what, fight against these diseases. I'm doing so because you say abuanura system wafa system to the extent we bedroom intestines. No. Meanwhile, we know the intestines are creating a pH of acidic medium and reactive with what? The food substance to break it down. But this enteric fever or the salmonella typhi is able to survive all these things because it can survive under a pH less than 1.5, which is a very strong acid. It means the body has been able to pass through the first pass effect. It has been able to pass through the second defense mechanism. Do you get it? It's occur system numa the obesa ABM say. Then you go straight to a place called the payer patches. And the payer patches are found in the distal part of the heart, the small intestines. And we know that it's the small intestines, you know, that's where absorption and then most of the digestion what takes place. But when you go to the distal, say the anokra, the tip or the far end of the heart, the small intestines, you know, and so when you baby say a place called the payer patches. When we say payer patches are just group of lymphoid tissues. And then lymphoid tissues, no, they are responsible for the production of what do you call the macrophages. And we know the macrophages are our immune boosters or our immune system. They produce white blood cells for them to come and fight against these diseases. And this organism is so sensitive and so wise enough, say, when you share the payer patches one, you just go and then take over immune system. Now, body need moment produce macrophages to come and fight against you again. But salmonella typhi, you know, one on the engine room no to operate. All because he want the organism to know, say, he want the body to realize, say, he is also part of them. It will form 1 and 4. Then he will now come out, take the engine room. We have something called the So you now take over this thing, the payer patches, and then try to produce more of what macrophages to the system. It will not so coin or produce more of white blood cells to the system. And the entire OS I say or person was check so that on to bet me now what because now you find the place to be favorable. Into a show kakra, no when no so. Then afterwards, no, once we're gaining those number now or pen in the system now, we then move ahead and then stop the production of the macrophages again because now macrophages now back into this. And one thing is the white blood cell, the moment you produce them, they come straight towards the bloodstream. Into a horn of bloodstream on or by the juma bebree. So they will now come straight to the bloodstream. And also share the machine room, you know, for its own hot production. Into a reproduce more. That's an call for also be one. Now they will move into what? The lymphatic systems and then other parts of the body like the liver, the spleen, the bone marrow, and then the lymph nodes. Into your producing macrophages, you know, our pulse system, no, there's no more production of macrophages. And or no, achichemun and call for no, into wokoha, okoha. So they will be moving through these organs. Some will go to the thoracic duct, others will go to the spleen, others will go to the liver, others will go to the bone marrow. And their target is that the moment you reach such an organ, somewhere in two, let's say I'm in Kumasi, and my farm about in Kumasi, no, makofa minian maybe about Fadi, maybe about Meduma, maybe about Hanum. The target is that ebia at the end of 2 years, no, obiawo and mienu miensa because a tax or mission into the bar crooning. So when you get to your liver, the local spleen will get to the spleen. Their duty is there to multiply to a density where the organism is what required. Into a no money be. So when they reproduce there and then they grow to a certain density, now they are sensitive enough that they know say when they come into the bloodstream, they are going to die because of the presence of these macrophages. So what the organism will do is after will be stimulating something called the machine aspect. Now we're causing something called the macrophages apoptosis. When we say apoptosis, it means just dying. So the macrophages within the bloodstream will start dying with the release of hormonal enzyme be releasing. So all those WBCs in the bloodstream, they all start to die or wrap up from what? The bloodstream. The reason being that when it comes to the bloodstream, these macrophages will fight against them. Into our before you come out. It is a regime for if they are no more, meaning we can now hot attack the system. After knowing that organism undergo macrophages apoptosis now, then they will move liver mono. They will now move to the bloodstream. Those in the thoracic that will move to the bloodstream. Those are the other side also move into about bloodstream, causing what? That's the septicemia or either bacteremia. Now they will infect the what? The blood. And then after the infection of the blood, they will now come. Some also those that went to the gallbladder aspect, they will try to infect the gallbladder either by direct infestation of the gallbladder or bile na gallbladder need produce, making it poisonous, or they will infect the gallbladder, the bile, so that when the bile extends to the gallbladder aspect, it also what affects what the gallbladder. Meaning say take over the body system, so they are able to what do whatever thing that they want to do. And then if the system, and I say the host organism, say when it's me transmitting organism for one some will be shared in the stool. Until a baby pass it through the stool, so that at the end when you defecate somewhere, there will be presence of what? Salmonella typhi organism or over in the hot in your stool. And that's why the reinfestation what continue and continue and continue again. Until I'm saying undergo all these processes in my system. During May, when I shield or when I try to defecate somewhere, some will be present in what? My feces. And no being so as I cut the fecal route. So there will be reinfestation in the in the system. So these are the small knowledge about the enteric fever, how it causes their illness. All right. So how do they present themselves? They usually present with mild fever. Into normal fever, you will not get a very high temperature. The temperature will be very less, let's say 36.2, 36.3. And should severe, yeah, or 40 plus or no. It's just some small fever. And then they will have what we call the frontal headache. Into one just say miti pie me pa. But the description will not be the whole aspect of the head, but just the frontal aspect of the head, and will feel that severe pain. And then the first 2 weeks, you see that you start having diarrhea and then abdominal pain. And then this abdominal pain mostly is present at the right iliac fossa, where your appendix is located. Into baby our appendix, that's where you start feeling your severe or massive pain. So if you don't do your clinical assessment well, you might think that the person is having appendicitis. Meanwhile, it's just typhoid fever that is causing this. And then they have other chest infection signs like cough, difficulty in breathing. So this is what the patient will present. And because I say they went to the liver, the spleen, and other vital organs to what? To reproduce it, Those organs like the liver or the spleen, they have to overwork because now there's a foreign body in their system. So all these organs will overwork. And because of that, you see say the patient will present with all palpating abdomen. Now you see say the liver and the spleen, they've all enlarged a little bit. It's because of the physiological aspect now, the pathophysiology that went on during the we see this phase now. So you have a hepatosplenomegaly. At times, when they get to the blood, one thing is when there is infection in the blood, a supply to any aspect of the body. Some will go to the brain, others will go to the heart, everywhere. Into wherever organism never find itself suitable, ultimately cause something bad. So when they travels to the brain, then that's where there will be something like confusion and then psychosis. So who patient you might end up presenting with a psychotic signs. Yeah, because a mental something, but meanwhile, is the enteric fever that has resulted into what? Into that. And then you have a very low pulse for patients having a cardiomyopathy and the endocarditis. These patients, so when it results in endocarditis and then cardiomyopathy, the patient will come with a very low pulse. One here you might think say it's something different and the patient is even going into shock. Meanwhile, it's the enteric fever that is causing those signs. So these are the main signs and symptoms that the patient will present. What are the possible labs that we can do? So as I said, the first thing is you have to exclude our malaria because we know that patients with these signs, they can also come as I presented last week. These are also signs that mimic the signs of malaria. So you shouldn't do anything without excluding malaria. So you can do your RDT or MPs just to exclude malaria. Should in case there's malaria, you treat. If there's no malaria, you go ahead and find your. Then you do our FBC, our full blood count. Now, because there was more of macrophages in the system, yes, our lab where you see say most of the patients, our WBC were very high because one question on our trigger the production of macrophages, dominant in the system or the bloodstream. So when you do your full count, you are expecting that the WBC should be hot, should be very, very high. And then again, the main laboratory test that we can do to isolate this organism is culture. So either your blood culture, your stool culture, or your urine culture. That's the definitive investigation that you are supposed to do. Because, as I said, so omunyaba bloodstream now, when you take your blood sample and do your culture, you'll be able to isolate the organism. And then one thing about Ghana is, obi yare ya no rat drugstore, meto antibiotics, meto anti-malaria. So it's a bit me about say you are even resistant to a certain drug. But when you do your culture and sensitivity, it will be able to tell you the particular organism that is causing, whether it's the Salmonella typhi or the Salmonella paratyphi. And then it will even give you a drug that this organism is even not sensitive to. So the blood test is supposed to do within the first week of what? The infestation. After the first week, if you do the blood culture, you will not get it. So you have to do a urine culture for the second week. And then subsequently, the third week, the best thing is what? Your stool culture. Because at the end, the organism was harbor it in your stool until the ova will be present in your stool. So when you do your stool culture, that's the best test that you can do to isolate this organism. We have the other tests like the radar test, but I don't know, and yet that's sensitive to this organism. I always say Ghana is a system you design and said yeah, obiara betimi afford healthcare. Let me put it like quality healthcare. And because of that, no, when these tests, no, you say blood culture no, is very expensive. So if the patient cannot afford this, what can I do as a government to also help my people to survive? In 10 years, I test and the test is what? With that test. So it's not sensitive. Until you realize that even you will test positive today, you retreat, you come back, you still test positive. Overcast or typhoid and coda because of the test that you are doing. You are supposed to do the what? The important test, whether the stool culture or the urine and the blood culture. So those are the sensitive tests that we can do. By the radar is insensitive. Just that those are the things that we can afford. So we design it in a system whereby it will favor everyone. And then it can give us a clue that you are presenting signs and symptoms of typhoid fever. Then we look at it. So as I said, our differential diagnosis, malaria, as I said, helminthiasis, other causes of diarrhea. So the fact that the patient is running doesn't mean that when you're typhoid. We have to exclude other causes of diarrhea like dysentery, amoebiasis, cholera, and the rest. You have to do all those tests to exclude them. Though that's not the main cause, but you have to exclude all these. So the potential, our likely differential diagnosis too is other causes of diarrhea. And then appendicitis, as I said, they present with abdominal pain at the right iliac fossa. So you shouldn't exclude that. I also your assessment, you say it's indeed typhoid fever, appendicitis. And then our have viral hepatitis because they will go to the liver. The organism will go to the liver and multiply. Until they will also give you signs and symptoms of what? Coming from the liver. If you don't take care, you might think say the patient is having hepatitis, which you don't know even the type. So all your concentration will be there. But it's good to exclude all those ones, toxoplasmosis and the tuberculosis, because I told you that some of the organism will also move towards the thoracic duct. So if they move to the thoracic duct, they too they have their own signs and symptoms that they will present. If you don't take care, you might think that because the patient is coughing for several times, maybe it's tuberculosis or something. But it's good to exclude all these differentials. So the mainstay of treatment is hydration, especially someone who is presenting with diarrhea. You have to replace the lost fluid and then electrolyte. So you have to hydrate this patient if it's very severe. But if it's not severe, we go in for a good nutrition and then our antibiotics. The best antibiotics now is the fluoroquinolones. The fluoroquinolones, we can get some like example is the ciprofloxacin. So that's your major a year waha. It will be by a cipro. It's because that's what the organism is very hot sensitive to. So we trying to cipro na say and it's good to do the culture and sensitive because for you know, patient now abuse drug to the extent say the cipro is not even sensitive to what the organism or the cipro, the patient have become resistant to us, the cipro. So if you do your culture and sensitivity, it will even give you all this clue that maybe the Cipro will not even work. If the Cipro doesn't work, we have alternatives like the cephalosporins. Example is the ceftriaxone, ceftriaxone, and then the others. In severe drugs and severe illness, we have to add our steroids to it so that the steroids will what, reduce the rate at which the organism is producing more of the what, macrophages. So in this very severe illness, whereby a patient needs to just add your steroids so that all the inflammation process that's going on, it will be reduced. So the likely possible complications, I always say we have to treat it as early as possible. And the management option is very good, whether to hospitalize or not. If patient never know and I say also a normal thing, or because the patient is or friend in or the jikofi, you'll be fine. It is going to be complicated. As we said, we've already talked about the typhoid psychosis there. And then the second thing is myocarditis, as we said earlier on. We can have GI bleeding, bowel perforation. That's the serious aspect. Because M1 be yet dominant in the bladder. That's where it will cause peritonitis. And then if you don't take care, you see, say, you will have some perforation somewhere. So these are the possible things that we have to look at so that we don't end up sending our patient home that early. One thing that we have to know is after the treatment, you are supposed to do at least 3 consecutive stool cultures and see whether it is negative before you know that now you are free from this bondage. So, who treat you? Yeah, don't sit home and say, oh, my treaty typhoid never. You have to come and repeat your culture, and you have to repeat it at least 3 times to know, say, now there's no salmonella typhi in your system again until you are free to go. Other than that, you might think, oh, man, I'm okay. Meanwhile, you are not. As we said, you will harbor it in your stool. Into nipa or system na wasawo the distal part of what you can say the intestines called the PR patches. No, if you don't treat and then you don't do these cultures to know whether the organism is no more, it's going to send you to these complicated signs that we thought about. All right. So what are the likely preventions that we can do? As we said, it's a disease of poor sanitary conditions. So we have to maintain a very good standard in our system. And then personal or good personal hygiene is also encouraged. You can't be back so media. No. Personal hygiene there, it has a lot. When I'm always educating my patient, I tell them, say, you will visit the lavatory with your phone. Lavatory, when you came back, you thought it why say there's a need for you to wash your hands. What phone not to wash your hands? Now phone out the corner, they know the over any day. After washing your hands, you come back, you pick your phone. You still infect yourself. So if you know say you can't just wash or sanitize your phone, then put it somewhere and then visit the lavatory. When you come back, you come and pick your phone. Other than that, what the phone at least sanitize your hot, sanitize your phone to know say the ohro on my phone. Do you get it? At times someone will be in his or her car. Sister Sandra bet me at my front desk. Or yeah, when your chips be or type kakra, no you chips back kakra. Forgetting say keyboard no crano. There might your hospital so. Bibi bet me settle on the keyboard. But what type back where you chips back, forgetting say you will even sanitize or wash your hands before you do this. So these petty things, you handle money, what you came, all chips and plantain chips, fine. Mate Bussel's car, what is car, what the amount? What's the about so these are the petty things. So the personal hygiene is not that much, say, young prior them, no. But these are the small things that we can do to exclude the typhoid from our system. The second thing is the appropriate disposal of solid waste. If you dispose our waste very clear or very well, there's no way we are going to find ourselves wanting like this. Because when it rains, it will drain them to our streams. And then we go through process for us to come. It will come in our pipes and those things. And then we will fetch it. We will not even boil it. Then we take it to the system. So if you know, yeah, was boiling our water and those things, then let's what dispose our solid waste very well. And then the next thing is our food handlers. Market no. Wakɔ na open toast ɛyɛ no. Obi nso aba sɛ ɔpɛ aprɔprɔ yɛ ose den. So ɔpɛ de aprɔ no. All because of say ɛno na ɛfu. Ɛna ɔde bɛyɛ aduane ama yɛ. Ɔba nso onya adagye nhoro ho nyiyi mu abi ɛwɔ mu no. No blend ne saa na ɔde ama yɛ. We don't know what is causing these things. So what I say, if the organism settle on someone's feces and come and settle on those things, now your answer and blending ye, your answer home ye, and take care of very well, we are going to end up infecting ourselves. So what I say, so you go, you say open the F, kinky run on those proper. You really so kinky yarn you could know before they could do. So all these things are the things that we have to know. Your fruits and vegetables that we buy, do we take time to wash it very well before we take it into our system? So the food handlers too, ideally, or mobile background now, we are supposed to do the stew culture for them to know that they don't even present with any hot over. So that's one thing that we have to also watch. And then the last thing is the vaccination. You have to, when you are getting into some pandemic or endemic area, you have to get vaccinated so that all these things, you will not witness such. All right. So my reference is from the Standard Treatment Guideline 2017, MESCAPE, Harrison Internal Medicine, and the Methods in Microbiology. Thank you very much. At this time, I will welcome more suggestions, additions, contributions, and then if there's any other question, we can also tackle that one. Thank you.
Wow, thank you so very much. I mean, I wish we were in a conference room to clap our hands for Dr. Eric. I'm really enjoying these sessions, and I'm only just worried that some of our friends have decided not to show up. Okay, but let's address it now. Questions, concerns. I think somebody as a Dr. Eric because usually I do most of my text messaging at the washroom. I try to make good use of every time when I wake up in the morning, the 10 minutes I want to go and use the phone there, read something. I never think of sanitizing the phone. I'll wash my hands. But it's good we have this information. Dr. Frank Bacho, are the oddities around you? Because these things that Dr. Eric said, it cuts across everybody's life. For Sandra and Nyane, are they around you?
No, please, they are not here.
I beg you, please. Anyway, any questions?
Yes,
yes,
please.
Janet, go ahead. Yes, please.
So, I would want to ask Dr. Eric, you said that with this type of diseases, it can affect different parts of our body. So, I would want to know, does that mean we use one specific drug or a general drug to treat everything, or based on where it was infected, then we have a specific drug for it?
Oh no, we have a generalized drug that can cover for the organism. As I said, there are groups of drugs that we usually give. So the first class was the phenylcholinesterase that I said. Example is the Cipro. Yeah. But one thing is, in our pharmacies and I say outside our ward, you won't say, Obi Krabeba no ordin can abuse drug. So after doing the culture and the sensitivity, as you know, the laboratory technician or they will give us the kind of drug that you are even sensitive to, and then what the organism to is sensitive, and then the drug that your body is resistant to, they also show them to us. So it's a general thing that we give, but we treat individually according to the signs and symptoms that the patient presents. Please, do we get it?
Yes. Thank you. And I wanted to also add up that, in our type of society, most of us, before we come to the hospital, it is critical. And per your presentation, you said that most of the times during the first week, that's when we can use the blood culture, right? After it
Yes,
passes, you have to use others. But mostly when they come, they can't even recall exactly when things started because maybe it started a week ago, but they took other medicines thinking it's something else. So how do you verify to know the time period?
so it involves how crucial you engage your patient in conversation. So yeah, sure, you call for by the time that they will come, he will tell you say maybe I start 1 day, 2 days. But even their relative will start telling you so boy, I start here this and now this. So you have to involve your patient very well. Let the patient understand say why yeah, I cannot be. Me, I always tell my clients that say one kind of crana. Me call lab na I cannot be because if the patient doesn't speak the truth, you will be tempted to do all these three cultures: urine culture, blood culture, and the stuffs. And I think one even costs not less than 300 cedis also. So when you engage them and then you tell them the costs involved now, wait me is specific for you to know the kind of the time now at any start here. Please do you get it?
Yes, I do. Thank you. And the very last one is more of a caution to all of us. I realize that, please, am I heard?
Yes, please.
Okay. I realize that most of the sellers, even aside they putting our lives in danger by buying cheap products, when they are selling to us, they use their bare hands. You see somebody using the bare hand to pick up something, and when they are coming to remove something for you, they'll not even use a rubber. They want to use their bare hand. And mostly we feel shy to tell them because we believe we are but that's not it. Your health is important. If you realize sɛ nipa no a ɔtɔ adeɛ wɔ ne hɔ no ɔde ne nsa sometimes some even have kids, they will just change their diapers and they want to use their bare hand to serve something for you. Ebia ɔde yi nam anaa biribi kosua na ɔde ne nsa saa. No, let's ask them that maame pakyɛw fa rubber hyɛ wo nsa. If they feel offended, stop buying from them because your health is also very important. Thank you.
Okay, thank you too.
Very good discussions here. Yes, Angela, let me call names. Angela from the nursing department. What do you have for us? Any feedback, any observations, any questions? We have to be done in the next 8 minutes. So.
Typhoid fever is known for some very diagnostic presentations, if I should call them that. We have the diarrhea. It presents as a pea soup diarrhea. Into to say abedu we grind it into soup. That is how the diarrhea that the people with typhoid fever present. Yeah, diarrhea is like pea soup. It's greenish, very watery diarrhea. That's one thing. He also mentioned rightly, say the fever starts very mildly, but after the first, second week, if left untreated, it has a presentation called the step ladder fever that rises up gradually to a very high grade fever of 38 to 40 degrees Celsius. Into about with low grade fever, now who admit patient now, and you have your fever chart, the temperature chart, you'll be seeing that the temperature will be rising gradually, like steps or a ladder. It will be increasing gradually until it gets to that high grade fever of about 40 degrees Celsius. So there's also that there's a pea soup diarrhea, the high grade fever, and then there's another presentation called the rose spots. And also sir, within the first weeks, in people who are fair, in young dark people, we may not see it, but they will have uh, spots, red rashes on their chest, but resolve very quickly. In about 5 days, the rashes will resolve. And if those rashes are cultured, find the bacteria in the biopsy is because, as he was explaining, when the bacteria starts disseminating from where they are stored in like in the liver, no, the emboli can start showing up under the skin as those rose spots, those red rashes. So thank you again, Dr. Eric. Very, very detailed. He went through the pathophysiology. Once you understand that, you see everything. That was the letter I wanted to add. The pea soup diarrhea. You always have to ask if the diarrhea is green. You have to check for the stepladder fever. It starts very mild and then rises gradually, and then it can persist for weeks, even up to 4 weeks, and then the rose spots, if they have noticed anything like that. Okay, thank you.
All right. Thank you, Dr. Frank.
That's very beautiful. I feel so excited about this already. And
Sorry,
go ahead, Frank.
Sorry, I just remembered a fourth thing. He also mentioned again rightly this fever, high fever with relative bradycardia. In adults, when your temperature rises by 1 degree over the normal, your heart is supposed to react by increasing your heart rate by 10. Into 37.4, na 38.4, your heart rate, and so it will increase above the normal 100, not to 110. By every 1 degree rise in temperature, your heart rate increases by 10. But in typhoid, Nissan your kind, there's relative bradycardia. So, who say obi temperature cost so that much, na the heart rate may increase accordingly by 10 beats per minute for every 1 degree rise in temperature. You should also be suspecting that. So, as you say, and your vital check-ins, they are very important. In case you check something and it doesn't correlate, you should try to check it manually, because sometimes the SpO2, the oximeter will give us wrong values. You are supposed to check manually to make sure it's actually correct. Some of these. Okay, thank you.
Okay, and then additionally, I prefer that we do things manually than using these electronics, because how you know that even the pulse that you are checking is regular, is irregular, or irregular. So those technology needs but for me, I prefer we do things manually, because all these things classically you can just come and then tell your doctor, oh please, define a person. This is how it is presenting, and it also gives us a clue on how things are going. So at times, if we tell you to maybe do things manually, please, we should all correlate and then do the appropriate thing. Thank you.
That's well noted. Thank you. We have just been joined by accountants. Let's acknowledge Mr. Owusu. And it's been insightful, very insightful discussions. Really thankful to Frank and Eric for putting this together. As I mentioned, in the coming months, we will not only do with the physicians, but we'll do with the labs and the pharmacists, as well as the nurses. We all have to be educated. I'm going to put this on YouTube. The idea just came, so I'm going to put this on a YouTube, and then I'll share it. I'll share it with because we already have a Gmail page. So right from this discussion, I'm putting on a YouTube, and I'll share it on the page so that our friends who would not join, you please encourage them that I need each one of them to listen to it. Sometimes these things, let me stop the recording for now. Just a second.